Welcome back to Julie's Village. I'm glad you're here. Today's episode is on a topic that came from a comment suggestion. I had not previously heard of this topic, so everything that I am sharing today, I do not claim to be an expert, and I welcome any additional information or clarifying information or any corrections. This topic is rejection sensitive dysphoria, or RSD as the abbreviation. Rejection sensitive dysphoria, from what I learned, is linked with, or often linked with, ADHD or anxiety. That doesn't mean that if you have ADHD or anxiety that you will have RSD, and you won't necessarily have ADHD or anxiety with RSD, but they have found that most people who do have RSD also have a diagnosis of ADHD or anxiety. So what rejection sensitive dysphoria is that there is something called rejection sensitivity, but dysphoria is a little bit different than this. Closely related is also emotional dysregulation, but this is tied specifically to having difficulty regulating those regulating emotions when it is tied to rejection or perceived rejection. The emotions can range from extreme sadness to anger or rage. Along with that, what sets it apart from just being rejection sensitive and being rejection sensitive dysphoria is when there is a feeling of intense emotional pain that goes along with it. So this intense emotional pain can lead to other symptoms, and these are symptoms that you as a parent might notice in your child or might want to be aware of and watching for in your child if they do already have ADHD and anxiety. If they struggle with rejection and you see those big emotional reactions, whether that's that intense sadness, those tears, those withdrawing symptoms, or if you're seeing more of that anger or rage, then you might want to keep a close eye and maybe have conversations with your child to see if they are expressing any kind of extreme pain or emotional pain, or you might see them say things like you might see some social withdrawal. You might see some perfectionism where some people deal with this by thinking, I never want to be rejected, so I will always be perfect. I'll always be the perfect friend. I'll always be the perfect student. Whatever it is, they don't want to feel that rejection or, again, that perceived rejection. For all humans, it's very common to feel uncomfortable when there is rejection, especially when it comes from friendships or family or romantic relationships. But it's intensified again when there are other conditions at play, that ADHD or that anxiety that can be intensified. But if this RSD is present, it sounds like it's even more intense. The experts are not really sure, it sounds like, on why this happens or why it often comes with ADHD. But there are some theories that maybe it's because of brain function and development, that because somebody with ADHD, often their brain does function differently, then part of that functionality might be what is contributing to the fact that there's also this dysphoria. As far as treatment goes, if this is an area of concern, I would, if your child has any kind of mental health provider, I would bring it up with them. And if they haven't heard of this, you might want to ask them to do some research and look into it more and see if they have any additional thoughts If your child does not have a mental health professional as part of their team, then you can bring it up with just a health professional. And once again, if this is something they haven't heard of, you might ask them to do some research and meet with them again, and then look to see if what forward steps would be best for your child. Again, this is an area that I don't know much about, but I think it is worth taking some time to look into if you have any concerns related to your child. Again, if you're seeing some extreme withdrawal from social situations, if you see some pretty big emotional responses and they seem to be heightened when rejection or perceived rejection is involved, or if you are seeing that they are having some pretty extreme perfectionist tendencies. There's a lots of things that can contribute to that, but a health professional or mental health professional can help tease out what might be the underlying cause. Again, if you have any additional thoughts, input, recommendations to go along with rejection sensitive dysphoria or RSD and how it relates to ADHD and anxiety, or just as a standalone, I invite you to leave that in the comments. If you have questions or suggestions for future topics, or if you have any people that you would like to see on future episodes, I invite you to leave that in the comments. If this information has been helpful to you, I invite you to like, share, subscribe. That helps make this information more accessible to others who might also need it. Thank you so much.